Today, I am Maria Charmin Age Between from BSN 21, and I will be demonstrating on how to use a pulse oximeter. The purpose of this procedure is to measure the arterial blood oxygen saturation and to detect the presence of hypoxemia before visible signs develop. So, I have gathered all the necessary equipment for this assessment. We have here the oximeter probe and appropriate for patient and recommended by manufacturer, alcohol wipe or soap and water, acetone or nail polish remover if needed, and this is optional. So since our client doesn't have nail polish, we don't need it. Also, we need a ball pen and vital sign sheet or record form, and lastly, clean gloves, but this is optional. Okay, so we will now start the procedure. So first, check the order for the placement of pulse oximeter to be able to know any health problems that would affect the patient oxygen status, such as COPD, lung cancer, heart attack, asthma, congenital heart disease or birth defects, and pneumonia. This is to ensure appropriate patient is monitored. Next, gather equipment including paper and pen for recording vital signs. This promotes organizations and efficiency. Next, perform hand hygiene. So I already washed my hands. You can also use alcohol. This reduces transmission of microorganisms. And then identify the patient for verification. Hello, Be. May I know your name?
Ella.
Okay, Ella. How old are you?
6.
Okay, thank you, Ella. So, Ella, I'll use a pulse oximeter to check your oxygen saturation. The amount of oxygen given to your body is referred to as oxygen saturation. There is no discomfort associated with this operation that we will perform, because all you have to do is place or clamp your finger in this pulse oximeter so that we can determine whether the amount of your oxygen flowing through your body is normal. Is that all right with you, Ella?
Yes.
Okay, great. Then, prepare child and family in a quiet and non-threatening manner. So, I've already closed the curtains and door here. This enhances cooperation and participation, reduces anxiety and fear, which can affect readings. So, Ma'am, we will be placing a pulse oximeter to your child so that we would be able to assess the oxygen saturation or the levels of the oxygen in the blood of your child, okay?
Yes.
So, this would help us evaluate the current statistics and conditions of the patient, right?
Right. Yes.
Okay, thank you. Next, determine if the child has undergone a test that use an intravenous dye, because presence of intravenous dyes may interfere with pulse oximeter readings. So, we will now evaluate the client's status in order to determine the child's condition, particularly if the child requires oxygen saturation monitoring due to clinical signs and manifestations of respiratory distress. Next, select sensor site that is free of moisture and drainage. You may use the patient's index finger, middle finger, and ring finger. Assess capillary refill and proximal pulse at the pulse closest to the site, because adequate perfusion necessary for adequate reading. If the circulation at the site is inadequate, consider using the earlobe, forehead, and bridge of the nose. Use a toe only if the lower extremity circulation is not compromised. Next, clean the site with an alcohol wipe. Then, allow the area to dry and if necessary, remove artificial nails or nail polish if present or select another site. Clean any adhesive tape. Use soap and water if necessary to clean site because nail polish and artificial nails alter results. Next, follow manufacturer's instruction for setting up oximeter. Connect sensor to oximeter and set alarms as ordered to assure accurate reading. Position sensor with light emitting diode or LED and photo sensor aligned to an opposite side of the selected site. This prevents optical shunting and ensures accurate results. Please. Then, obtain reading. It determines oxygen saturation. So, the oxygen saturation of the patient is 97% and the watch pulse bar for pulse sensing to determine rate. And her pulse rate is 82 beats per minute. You may obtain arterial blood gas or ABG if ordering. This promotes confidence in oximetry readings. And sometimes, we're actually sensitive, we need to cover sensor with the sheet or towel to protect it from exposure to bright light because ambient light can skew readings. Then, we have to assess probe or sensor site every 2 to 4 hours. This protects against skin breakdown, ensures correct placement. Sometimes, you may rotate probe or sensor site every 2 hours for a spring-loaded sensor and every 4 hours for an adhesive sensor because it maintains skin integrity. Assures accurate reading. Okay, so we're done taking your oxygen saturation, Ella. Thank you for your cooperation. Then, I will clean the non-disposable sensor according to the manufacturer's direction. And then afterwards, I will now wash my hands. This reduces transmission of microorganisms. Lastly, document procedure if indicated. Pulse oximeter readings at regular intervals per agency policy, site sensor applied when changed, skin condition at sensor site, setting of alarm limits, this is optional, to provide record of the procedure done. Okay, so our client is 6 years old and today is April 23, 2022 and it's 2 o'clock p.m. I got reading of 97% autosat and the heart rate is 82 beats per minute and the respiratory rate is 22 beats per minute and the temperature is 35.7 degrees Celsius and for the blood pressure is 110/60 mmHg and all the results are within the normal range appropriate for her age.